Hi, you guys. Welcome back for our daily practice questions. It is day 205 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminders that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and it houses all of my resources that I offer. And if you're looking to gain access to the last two spots for the FMP and AGMP 5-week intensive review, the link is in the description to enroll. Class runs from August the 11th through September the 12th. All right, question number one. A 45-year-old male with no past medical history has an LDL of 190 milligrams per deciliter. What is the most appropriate initial treatment? Is it A, lifestyle changes for 6 months, B, initiate high-intensity statins, C, begin ezetimibe, or is it D, recheck lipid panel in 3 months? Take a moment and tell me what you got. All right, stem of the question states, what is the most appropriate initial treatment? And y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So it's asking for a treatment, and I always say if they're looking for a treatment, first look to see if they've provided you with a diagnosis. If they have not, you got to run it back a step further and look at those assessment findings so that you can gauge what it is, because you got to know what it is to be able to treat it, right? So here, let's look at the assessment findings because there's no diagnosis. It says we have a 45-year-old male, no past medical history, but the LDL is 190 milligrams per deciliter. All right, so we're thinking hyperlipidemia, right? And remember, LDLs, we want less than 100. Now, for this, remembering that statins work to decrease LDLs. So you want to go with B, initiate a high intensity statin, right? One, we're going to use statins, but the reason you're also going to use a high intensity statin because the high intensity statins bring LDL down by 50% or greater, right? So 50% would be great because it'll cut this in half, putting them less than 100 for that LDL. All right, question number two. A 32-year-old presents with symptoms consistent with moderate major depressive disorder. She has no history of suicidal ideation. What is the most appropriate initial management? Is it A, refer to psych immediately? Is it B, start fluoxetine? Is it C, order MRI of the brain? Or is it D, recommend only psychotherapy? Take a moment and tell me what you got, y'all. All right, and stem of the question here states, what is the most appropriate initial management? So again, have they provided us with a diagnosis? And they have in this situation. States that the patient has moderate major depressive disorder without suicidal ideation. Again, remember, we talked about this. First line therapy for major depressive disorder are SSRIs, right? So B will be your best answer. All right. Lastly, question number three. A 60-year-old African-American male has a blood pressure of 152/92 on 2 separate visits. He has a history of allergic rhinitis and gout. What is the most appropriate first-line antihypertensive? Is it A, lisinopril? Is it B, amlodipine? Is it C, metoprolol? Or is it D, hydralazine? Take a moment and tell me what you got, y'all. All right. And stem of the question, what is the most appropriate first-line antihypertensive? All right, so let's see what we have going on. We have a 60-year-old African-American male, blood pressure 152/92. It's been like this on 2 visits. He has a history of allergic rhinitis and gout. So how would you treat? So B is your best answer, your amlodipine. Remember, in African-American population, you can treat with thiazides or calcium channel blocker. I always tell you thiazides are the captain to go with that first across the board. But in this situation, this patient has a history of gout. Remember, gout is a contraindication for thiazide management, so the best answer will be B, amlodipine, a calcium channel blocker. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. I'm hoping that you found this helpful. Be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call. You can also shoot a text message to this number or shoot us an email. Everything that I offer is linked in the bio of this channel, including my website. And as I mentioned previously, my website is also linked in the description of this video. So if you're looking to gain access to any of my resources, just head straight over to www.thenursingstudio.org. But y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.